Excess weight causes a variety of health concerns no matter how you look at it. But when that excess weight causes lung problems, it's time to look at both conditions. In recent years, as obesity has evolved into a global epidemic, more and more research has been conducted to shed some light on its connection to other diseases. And there have been quite a number of studies that have looked into the role of obesity in chronic obstructive pulmonary disease, or COPD. Why? After heart disease and cancer, COPD is the #3 cause of death in the United States. We spoke with Ed Neuzil, board-certified nurse practitioner at Allergy, Sinus, and Asthma Family Health Center, about how our weight, and particularly excess belly fat, raises your risk for developing chronic COPD.
Well, COPD is a chronic obstructive pulmonary disease, so this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator. A lot of times people don't understand. They think that what they have is normal. I talk with my patients and ask them if they're short of breath, do you do anything to get short of breath? Well, no, not really. Did you ever do anything, activities? Well, I used to play baseball, but I don't do it anymore. Well, why not? Well, I just didn't enjoy it. Well, you know, if you played baseball and you got short of breath every time you played baseball, you ain't gonna play baseball no more, because we as a people have a tendency to do what we like and makes us feel good and not do the things that make us feel bad. And they don't understand the fact that this may be a change in their health. We know that the more weight we carry around, the more difficult it is for us to breathe appropriately. I ask a lot of my patients, and I try to do it in as kind of fashion as possible because I come from that particular point of view myself, being overweight. And I noticed it was to the point to where I just couldn't move. I could hardly do anything without getting short of breath. You can't bend over and tie your shoes. You end up having to put your shoes on the side of the tub or on something so you can tie them. It dramatically impacted the quality of life. So weight is a big problem. And so the more we can do to watch that and control it, the better off we're going to be. Lifestyle is a big factor, and we all want a good quality of life. We have a tendency to get together, and food becomes a big part of it. So as we become more social and we're eating more, we should be exercising more. And I tell a lot of my patients that if you want to get off some of your medications, then let's get some exercise. A lot of the individuals here we talk to, and we say, well, if you presented the way you are now like you were 20 years ago, you'd probably be in the hospital swearing you're dying, because you just got used to it over the last 20 years. And we just get used to the various changes in our life. Nobody wants to have COPD, and nobody wants to be a diabetic. But the more they can understand about this disease, even before they have it, the more we can prevent the disease.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Belly Fat and Breathing tab on our homepage, yourhometownhealth.com.